ladies from Common Sense Matters, and you have a guest today.
Yes, we do. Hi, my name is Sandy Rice. I'm from Suwanee, and our guest today is Mariah Phillips, candidate for U.S. Congress, District 4. Many of you have met her, and she has been debating all over the district, but today she alone is all ours to talk to. But first, some upcoming events for the Franklin County Democratic Party. We are opening our headquarters for the 2018 elections. The grand opening is Tuesday, July 17th at 6 p.m. It's at 420 East Main in Deckard. There will be refreshments. I would like to mention that. The party's monthly meeting will be Saturday, July 21st at 8 a.m. at headquarters. And there'll be another Common Sense Matters radio program on July 26th. The guest has not, or the topic has not been announced yet, but stay tuned for that. Other important dates for us are early voting starts July 13th tomorrow and runs through the 28th. If you want to cast your ballot before the August 2nd election, you can go to the Franklin County Election Commission office. It's at the Franklin County Annex at 839 Dinosaur Boulevard in Winchester. And early voting is available Monday through Friday, 8 a.m. to 4:30, and also on Saturdays from 8 to 12. On August 2nd, that's a Thursday, is Election Day, and you will be voting in your precincts. If you're not registered to vote, you cannot vote on August 2nd. The deadline was July 3rd, so you missed that. But you have time to get out and register so you can vote in the November general election. Registration deadline is October 9th, and I'll talk a little bit more about that in a minute. Early voting for the November general election begins October 17th to November 1st. Again, you'll vote at the Franklin County Annex. And Election Day is November 6th, where you would vote in your precinct. The general election in November, you'll be voting for governor, state representatives, U.S. Senate, and Congress. The election on August 2nd is actually two elections, but same times, you don't have to go twice or get back in line or anything. It is the general or final election for county offices, sheriff, mayor, county commissioners, etc. But it's also the primary for state and national races. Again, governor, state representatives, U.S. Senate, and U.S. Congress. So two important elections combined into one. Now, if you need a ride to get a photo ID or to vote, Franklin County Democratic Party can arrange that by calling 931-308-7207. Now, if you're not sure if you're registered or what district you're in or who is running, find a computer or smartphone or a young person and download Go Vote Tennessee. That's GOVOTETN. You can put your name and address and see if you are registered. You can register. You can find your district, where to vote on Election Day, sample ballots, everything that you need. If you have been convicted of a felony, and you can restore your right to vote if you've met some requirements, and those are all identified in sos.tn.gov. And there's information and forms for what you need to do to reinstate your right to vote. You can also call the Secretary of State phone number 615-741-7956, and they can direct you to a computer, smartphone, or a young person, or just help you from there. Okay. My guest today is Mariah Phillips, candidate for U.S. Congress, District 4, the seat currently held by Representative Scott Desjardins. Now, Mariah's been on the debate circuit the past several weeks with two other Democratic congressional candidates. So again, I feel fortunate that we have her to ourselves for the next 50 minutes or so. We'd love for you to call in if you have a question for Mariah, and our number is 967-2201. Got it? All right, ready. Okay, the 4th District, in case you don't know, covers 16 counties. And it's shaped like a croissant with a berry hanging off on the eastern side. Now, Mariah, you've attended events all over these counties for over a year. In fact, last August, after you've been campaigning for a few months, I think you started in April 2017.
I did.
You went to all the counties in a 3-day period.
I did.
To celebrate the 1 year, 1 year before the primary.
That's right.
And here we are.
Here we are, 1 year later.
And I just made a quick list. I don't know if you want to talk about some of the things you've done, but you've been all over the place. What's been your favorite? I'll give you 3 favorite events that you've been out in the district.
3 favorite events. Well, I will say one of the first events that I did as part of the campaign was going to the Strawberry Festival in Ray County.
Oh, yeah.
That, first of all, I love strawberries, and but the people there were very welcoming, fantastic. And being my first event as a candidate, that has a special place in my heart. So I was able to go back to the Strawberry Festival again this year and walk in the parade this year.
Okay.
And the reception was incredibly strong. We've built a lot of relationships there over the past year, and so when people call out your name when you're walking by, that I know that I'm making an impact and building those relationships. And speaking of that, the 4th of July this last year, we had the opportunity a couple weeks ago to hit a couple of different parades and different events across the district. And actually, going in Suwannee, and we were in the Suwannee 4th of July parade. And again, the reception was so powerful. People recognized us. They were cheering for our campaign. They know that we're fighting for the people of the district, and they're fighting with us, and that's pretty powerful. But if I could pick 3, oh my gosh, meeting the people across the district has been powerful in itself. I really love door knocking. I really love, not necessarily the events, but just the opportunity to talk to voters, to talk to constituents one-on-one and hear what their issues are, hear their stories, and figure out ways that I can help. And so I know that's not an event necessarily, but it is important.
So what are they telling you? What are their concerns? What have the people of District 4 told you about their lives? What they need? What concerns them? What they want from you? What they want from our government?
Well, overwhelmingly, people want to be heard, and they want a representative who's going to listen. What we've done over the last 16 months or so is to hear these people's stories, and I'm a teacher and a mom, and so it's kind of in my DNA to be somebody who listens and tries to help people solve problems. And so some of the issues that I've heard most often are concerning health care. People specifically in the 4th District have not had great access to health care. We know that there have been hospitals that have closed in our district. We know that there is a lack of access to health care, and health insurance has really impeded health care. And so the lack of access of health insurance has been a problem for many people in the district. People are concerned about education for their children. And, at the end of the day, Democrat or Republican, we really all want the same things. We want to know that at the end of the day, after a hard day's work, we have a little money to put in our pocket. We want to know that our communities are going to be safe, and we can take care of our family members when they're sick, and that our children are going to have a better life than we had. And they want somebody who will understand what we are going through every day and can actually impact legislation that will have a positive impact on their daily lives.
So what are, if healthcare is at the top, what are they telling you about their situation? I know that the hospital closures and a lot of things that have happened in Tennessee are due to Medicaid, the state not expanding Medicaid, which is really, Medicaid expansion was originally required in the ACA, the Affordable Care Act, Obamacare, but it went to the Supreme Court, and it was decided that states did not have to be required, and so 13 states decided not to do that, including Tennessee. So that's a real battle on the state level. So we're kind of left with the ACA, and it's taken a lot of hits. But it's still the law of the land.
Yes.
And so what are your thoughts on ACA? Do we need to fix it? Can we fix it?
Interestingly, I actually have been on both sides of this issue personally in my family. So I, again, going back to having a representative that understands our stories, I've lived them. I've had employee-based care for most of my adult life. My husband is a professional musician, and his job does not offer health insurance. So I've always been the bearer of the health insurance burden, and I've done so gladly because, we have 5 children, and so we need to make sure that we have health care to take care of our families. So employee-based care was something that we always offer that was important. And we had seen, prior to the Affordable Care Act being implemented, we started to see our health insurance plans becoming worse and worse. They were becoming more expensive, and they were covering less. We started to see, how pre-existing conditions were not being covered, and how that was having long-term impact. I had one situation prior to the pre-existing condition coverage where I had changed insurance companies due to changing jobs while I was pregnant.
Oh.
And I had to actually pay COBRA coverage on one insurance so that they would cover my pregnancy, because my new insurance would not cover my pregnancy because it was a pre-existing condition. So pre-existing conditions can be anything from acne to cancer. So one of the greatest things that the Affordable Care Act did was actually provide coverage for pre-existing conditions. And so I had another situation after the Affordable Care Act passed where my daughter was injured on the soccer field. My new health insurance, due to a new job, kicked in 3 days after her soccer injury, which meant that our old insurance company had to pay, covered the surgery, but the new insurance company had to cover the rehabilitation. Now, I didn't know she was going to get injured. I didn't plan on her requiring meniscus surgery and physical therapy. But, but that's what happens with our health. We can't necessarily predict when we're going to have an accident or an injury or a devastating illness. So because of pre-existing condition coverage, my insurance company did have to pick up the bill, and I appreciate that coverage and understand how important that is. And so now, moving forward, several years later, in January, I left my teaching position because I am running for Congress, and it was really difficult to do both in the way that I wanted to do both effectively, teach high school and run for Congress. So I stepped out and took a leap of faith and decided to focus 100% of my time on running for Congress, which meant, though, that I also lost my health insurance. So my husband and I got onto a plan through the marketplace, and it's not a great plan. It's incredibly expensive. It doesn't cover the things that we really need. For example, dental coverage for my college-age daughter is not covered under our plan. So we do need to fix the Affordable Care Act, but I actually think that where we need to go, we need to have a real conversation about expanding Medicare for all. I think we are the only developed nation that does not offer health care for our citizens. And not only does it make moral sense, I believe, but it actually makes economic sense as well. We need to have a healthy workforce. We need to have our citizens taking care of their health on the front end, preventative care, so that we don't have devastating illnesses later on that could have been prevented. And so I do support Medicare for all. And I think that's, so we need to do both. We need to protect the provisions in the Affordable Care Act, but we also need to put everything on the table, all options on the table, and make sure we're focusing on how do we get more people covered, and I believe that conversation will move towards Medicare for all.
I'm very interested in the topic of health care, as everyone that
I know
knows
you are.
me knows.
And actually, you volunteer in Beersheba Springs up in Grundy County, and I've been up there many times, and I just applaud the work that they do, because the citizens of Grundy County don't have very many healthcare options, and so a true non-for-profit healthcare facility. Thank you for the work that you do up there.
You're welcome. We have lots of stories that I'm not going to go into, but our patients don't have insurance, and they are working, and they're kind of able-bodied, but they're still trying to work, and I always ask what their job is and do they have insurance. And as far as employee-based, either they're self-employed or small business owners, so there's no option there. They make too much money for Medicaid, don't have the option of Medicaid expansion, and so they said that they don't get health care, or they pay privately. I have to say that all of our patients put a little money in the box, not $100 for what might cost them if they went to see a licensed physician, who a lot of times they won't see them because they don't trust that they'll have the money to pay for the care. Or if their employer does offer it, they may have to work for a year. There might be a $5,000 or more deductible, and so it's really rough, even if you are working. I have had some patients that have applied for Obamacare or the ACA, and I've never been a navigator for that program. I don't know the ins and outs. I don't have a strong financial background. I'm a nurse, for crying out loud. But
I have a friend who's a navigator for the
okay. Well, their funding is being cut.
It sure is. Yeah, and actually my friend Andrew was concerned last year because their funding was at risk. And I haven't talked to him the last couple of days, but that's his livelihood is he works as a navigator, and
well, my patients, they try to explain to me what happened, and they're very confused, and just things tend to not work out. Now, I imagine it does work out for some people, and I don't see them because they're at they're able to get a care where they can get referrals and X-rays and blood work and things like that. The other thing I see happening nationally is there's been a concern that Medicare for All will be socialized medicine, which it's not socialism. Socialized medicine would be if the government ran everything, and it would really be just the single payer system, everything, the hospitals, the physicians. Paul Ryan wouldn't be your doctor in Wisconsin, so it's not like that at all. But the private sector is not helping out. They've had a chance for decades, since post-World War II, and we are really suffering even more and more from that because there's no limits on big pharma. Not only are they responsible for a lot of the opioid addiction, the high cost of pharmaceuticals, but now emergency rooms are running out of essential medications, and there's a lot of excuses, but I think one of the things is that morphine and epinephrine and ephedrine and these old medications are not money makers. Right. It's more lucrative to come up with the 15th or 16th generation of a cholesterol-lowering medication. So we have the inability to pay for health care and the high price. So I do think looking at Medicare for All, the bill that is in the House of Representatives right now is not one page. It's 30 pages. It needs more people to sign up and some interest and some education on that to really make health care more accessible and affordable, but then also cut down the cost.
Well, when you talk to doctors, just to kind of add on to that, their overhead just in administration to process all of these private insurance companies and to deal with, each private insurance company and the individual plans on those insurance companies, it takes experts just to navigate those formulas. And so the overhead that the doctors have to pay to have someone to navigate our insurance company formulas, they would save that resource. And
the last practice that I was in Atlanta, the number of providers stayed the same, and the number of staff to shuffle the paperwork doubled.
Yes.
So that's not good health care, and
it's not good business.
It's not good business.
I'm saying it's not just a moral issue; it's also an economic issue as well.
Right. Okay. Well, like I said, I would talk too much about that. You talked about let's go to jobs, because that's another a big thing. And the GOP is pointing to low unemployment rate and tax breaks. But I want to know if people are telling you about the great jobs they have and the piles of money that they're making. Are they happy that their Tennessee taxes are so low?
Some people are. They're happy that they're getting additional $50 a month or so, and some people are getting that. I actually spoke to one man recently. In fact, last time I was in Winchester about 2 weeks ago, he was telling me that he said, you know what, I get $50 extra in my paycheck a month. He said, I would much prefer Social Security be solvent for the future than get that extra $50. He said $50 doesn't even put one tank of gas in my truck.
Right. I think gas prices are creeping up a little
yes,
bit.
Yes, they are. But I think that there is, some people are seeing a little bit more money in their pocket. Most people are not seeing a lot, but a little bit. And so you feel good about that when your paycheck is a little bit bigger. But what we're forgetting is that on the other side, we're losing some of the protections where Social Security is getting cut, and we need to really be paying attention to what we're losing with the tax breaks on the one end. But what people are actually talking about more is we have 3% unemployment right now. It wavers between 3 and 4% month to month. Tennessee has incredibly low unemployment. However, we also have incredibly low wages. We are the lowest paid state, the highest number of minimum wage jobs in the state of Tennessee. And so when we are, happy that all these jobs are coming in, what we really need to be happy about, or what we really should be focusing on, I should say, is not whether or not we have a job, but whether or not we have a job that could actually pay us a living wage so that we can feed our family. We currently are in a program where if we, an average person making, $7.25, $8 an hour as an individual, working 40 hours a week, still has to, in many cases, get food stamps, participate in the SNAP program just to feed themselves. They still require assistance from the government because 40 hours a week at $8 an hour, $9 an hour is not going to help you feed your family. So what we need to be really focusing on in the state is not just bringing jobs here, but bringing good-paying, high-quality jobs. And so we're not going to do that if we don't have hospitals in our district, right? We know that employers look for whether or not, there are hospitals, there are good hospitals in a community. They look for a good school system in a community and whether or not the schools are preparing the students for the jobs that they offer.
Or vocational training.
Or vocational training, absolutely. So those are the kinds of things that we need to be focusing on. What kind of jobs are coming to the area? And another thing that people are starting to talk about more, and I think is incredibly important, is access to broadband. And, a business is not going to come here if they don't have access to the Internet. And, in fact, small businesses can't grow without access. I was talking to a woman up in Grundy County. She's a farmer. And she was telling me that she's as a farmer and a small business owner, she sells her lamb locally, and she sells wool online. Where she lives, she has access to the internet, and she is able to then, be able to have an online shop. And that's where she makes a lot of her money, her income, is through online sales. But if you go a little bit further up the mountain, your cell phone service doesn't even work because the GPS cuts off, right? So we need to make sure that we're expanding broadband to our rural communities so that small businesses could thrive, so that students can learn more and more often. I'm a teacher. I know more and more often education is done over the internet. A lot of school districts are moving to online textbooks. Well, guess what? If you don't have access to the internet, an online textbook means you can't do your homework.
Right.
So we need to make sure that we are preparing our communities for the jobs of the 21st century through all of those resources.
Mm-hmm. Do you think the minimum wage will come up?
Oh, I think it has to. Tennessee doesn't have a minimum wage.
Mm-hmm.
We follow the federal minimum wage, which is $7.25. There was a study last year. MIT did a study that was focusing on the living wage across the country. They actually broke it down county by county by county. And so in the 4th district, the average living wage is $11.25.
Oh, well, there's a gap.
There is a gap.
Yeah.
There is a gap of about $4, right?
Mm-hmm.
So $4 an hour is quite a lot of money, and that's for a single person working 40 hours a week,
mm-hmm.
for them to be able to afford housing and to feed themselves and basic transportation.
Right.
And so there is a huge gap. If our living wage for a single person is $11.25, think about what a single mother of two
mm-hmm.
has to make. Her living wage would be about $16 an hour,
mm-hmm.
right? How many jobs in Franklin County are paying $16 an hour to a single mother, right? I mean, there probably aren't.
Well, and the other thing that I've noticed is that it's rough out there working for a company that would even pay that much.
Mm-hmm.
That if you're sick or the car breaks down,
mm-hmm.
or you haven't made your quota of putting your stuff away in a warehouse, you're out of there.
Yeah.
And so you can be working one week and not the next.
Do we
have a call?
Oh.
Good. Hi, this is Common Sense Matters with Mariah Phillips. Would you like to ask a question?
I would. I think the GOP passed in the new farm bill even more restrictions on food stamps, so that people who are working won't be able to qualify for food stamps. Are you familiar with this? And what do you think?
I am familiar with that. Thanks for the question.
Thank you.
So the SNAP program actually has just been revised in the local, in the recent farm bill. Scott Desjardins is actually on the committee to, and had an impact on this. And so what they moved towards was you had to actually be working in order to receive food stamps within 3 months. And but here it goes back to what I just said. I just told you that our unemployment rate is 3%.
Mm-hmm.
Most people in this state are working, but they're not making enough to actually be able to afford to live without the assistance of food stamps. So if we want to fix our food stamp system,
right.
we need to actually revitalize how we distribute the SNAP program and allow for a gradual decrease, because right now our SNAP program is an all or nothing program. If you qualify for food stamps, you get whatever that amount is. I have a friend who had been on food stamps for a number of years. Her husband lost his job, and she had been a stay-at-home mom, taking care of her 2 boys. One of her sons is autistic, and so she was a stay-at-home mom, take care of her boys. Her husband lost his job, And it took him a while to, he started working a low-wage job while he was looking for something more comparable, but with a family of 4, they still qualified for food stamps. Well, she decided that they needed to make more money while he was looking, so she got a job, a part-time job. She made $10 more than their quota.
Oh, no.
They lost $600 in food stamps. $600 in food stamps. So what did she do? She quit her job because she couldn't work enough to make up the difference of the $600. So it incentivizes people. The system as it's set up today incentivizes people, or I should say disincentivizes people to work their way off of the program. If we had a gradual step program where if you made a little bit more, if you got a promotion at work, if you worked a couple of extra shifts a week, your food stamps could be reduced a certain amount, you would eventually work your way off of the program. But the way it's set up now disincentivizes people to work their way off, because if you make $1 too much, you lose $600 worth of benefits, and that's what she saw, and it was devastating for their family.
And the other thing about 2 comments. One, the other thing about parents taking 1 or 2 or 3 jobs to make ends meet is those kids are at home, and then we come up on the other side of where's the discipline, where's the family? The family needs to be teaching and helping and watching the guns and, all kinds of things.
Absolutely.
So the kids don't get in trouble, but you don't make any money staying home taking care of your family.
Right.
The second thing is that there's such an anger, I feel, in our country today about people that need assistance. There's a sense that they're the welfare moms, that's been since the 90s, welfare moms, families that never get off welfare, they need to make better decisions, but so things are cut all the time. Well, you just need to get a job. Well, they have jobs.
Right.
And
in some cases, more than one job.
Yeah, and, stuff happens that not everybody is able or wants or has, financial ability to go to college and, own a company or, other big things. So things happen, and you shouldn't be punished for the rest of your life because, you chose a different life path, So I think that's something I don't think you'd be able to fix as a congressman, but
well, I
certainly worth understanding.
Yeah, I definitely
people.
Understand that, and I see that as a teacher in my classroom. Even in my own life, I've worked 2 jobs most of my life because my husband's career has been. It fluctuates. As a small business owner, as a musician, there are some years that are really good, and there are some years that are really lean. And he has worked multiple jobs as well, and we've done whatever we had to do to take care of our family of 7. And we've done so successfully. But there have been months when we actually had to have assistance, and that's with us doing everything we knew that we could do. And those benefits are there for our families who find themselves in a situation that they hadn't been prepared for. I know how hard families work, and there is a system of poverty that's hard to get out of if you're in that system. It's hard, just like I told you about my friend. It's hard to work your way up from the bottom. It's hard to pull yourself up from your bootstraps if you don't have a pair of boots.
It's a little bit easier post World War II.
It was, but post World War II, they actually had
programs.
They had programs. They had the WPA. They had the CCC. They had programs that actually gave our young people
GI Bill,
good jobs. They gave our unemployed. They actually put them to work fixing our roads and building our sidewalks. They had programs to help people get back on their feet, and we're blaming the people who can't get on their feet and cutting the programs that we used to have to help them stand up.
And a lot of blame. I just want to tell the phone number again to talk to Mariah this morning, 931-967-2201. I want to get over to talking about education and our young people. Was your family involved in politics?
Oh,
growing up?
Yes. I always like to joke, we watch politics like a lot of families watch sports. I grew up in a home that was very politically active. My mom was on the school board when I was growing up. In fact, I remember I think I was 3 years old, and I remember her victory party. It's one of my earliest memories when she won for school board. But we had always been politically active. My grandparents are were strong union members, and so there's kind of a connection to politics that's connected to that history as well. We have always worked for candidates. I remember actually in my community, I will age myself a little bit, but when I was in high school and Bill Clinton was running for president, he came to my community because we had a hospital that had closed, and he was running on health care. And we had a public hospital that had closed recently, and so he was stumping at the hospital. And my mom actually took me out of school to go meet Bill Clinton and shake his hand, and it was incredible to be able to do that. But I've always been very politically active. In fact, I was a political science major at MTSU. I'm a teacher, and I teach U.S. government because I love the political process. I love our government. I believe in our country. I think that we have the best ideals in the world, and our democracy is incredibly important. And I'm proud to now be on this side as a candidate. This was never on my bucket list. I never thought that I would be running for office, but it's been interesting to be on this side, coming from such a politically active family. When I decided to run for Congress, or my sister, who lives in Nashville and is also very politically active, she said, "You need to talk to my friend, Linda Sherrill." And I said, "Linda Sherrill? I remember her. She ran for Congress in my district." And she said, "Yeah, she's a friend of mine," because they worked with OFA together, Organizing for America. And so they knew each other through that organization. My sister had been very involved with that. And so she connected me with Linda Sherrill, and we had a good conversation. And I told Linda at that time, this was back early 2017, and I said, "Linda, why don't you run again? If you run, I will support you. I'll work for you." And she said, "Oh, no." She goes, I'm enjoying what I'm doing." She goes, "But if you run, I'll throw all my support behind you." And I am excited to have her support, and that was really one of the nails that confirmed that I was going to be running, was when she believed in me and was able to offer me her support. But yeah, I grew up in a very politically active family. I voted in every election since I was 18 years old. My mom took me out for ice cream the first time that I voted, and I remember taking my children in 2016 to vote. I had 2 children eligible to vote, so I took them to vote for the first time, and we celebrated as well. So
now you have a master's in educational leadership.
I do.
And you also took the Emerge training in
Yes.
2016. You want to tell us what that is?
Sure. Actually, the Emerge program was in 2017.
Oh, okay.
But yes, ma'am. So Emerge trains Democratic women to run for office. Too often, we women don't feel like they are ready to run for office, and statistically, we always feel like there's more that we need to do to prepare. So the Emerge program gives us the tools and the resources to prepare us for running for office, and they train women for all different levels of leadership. In my Emerge class, and I was part of the first Emerge class in Tennessee, so I'm proud of that. But in our Emerge class, we have people that have run for county commission, that have run for city council positions, that are running for state senate right now, and we have a a judge that has come through our program. So all different levels of leadership. And so the Emerge program is 6 months of training. We spend 1 weekend a month, and then we have homework to do in the process. But it teaches us, how to develop our message, how to talk to the media, how to pull together a team, how to, what are the important pieces of a campaign. So I was excited to be part of that program. Not only did they give me the tools and the resources, but they also helped me develop a network of support. Mm-hmm. And most importantly, the Emerge program gave me the confidence to know that I could do it.
All right.
Yeah.
We're going to take a break from education for just a second because I want to get back to that, though. But we have someone that's called in a question. Why is social welfare easier to receive than VA benefits? And vets are being reduced in their benefits at alarming rates. When will vets be treated with the respect they fought for?
That is such a good question. I've spent a lot of time, actually, in my life volunteering at the Veterans Home in Murfreesboro. We have a program called the Visit with the Vets program that I started with my students. And so I take them once a week to visit with the veterans there and hear their stories. It's an incredible program, and I have a lot of respect for the veterans and the people that are serving today. My brother is in the military, and he's in the Army, and so I have a lot of respect for the veterans that are currently serving and the people that have devoted their lives in service. But one of the things that I heard a lot about volunteering at the Veterans Home is that the veterans want to have a strong VA. They want to have a Veterans Administration that does take care of them, and we need to keep our commitment to our veterans. They have put their lives on the line for us, and we do need to fulfill our commitment. So what I think we need to do is make the veterans hospitals, the VA hospitals, stronger. Privatizing the VA is actually going to do more harm to the system than, just think about privatizing healthcare. How, has that actually made our system better? No, it hasn't, right? Privatization has actually been harmful. And so what we need to do is actually let's focus on fully funding the VA. Right now, the Veterans Administration is understaffed, and so if they don't have the staff and the resources